Yes, sir.
Good morning all attendees and panelist team. Today आज हमारी जो 15वीं वेब फ्री वेबिनार सीरीज है उसमें आप सबका मैं हार्दिक स्वागत करता हूँ। एक्चुअली आज जो 15वीं सीरीज है उसमें वेल नोन एकेडमिशियन एंड जो पर्सनालिटी हमारे साथ है, जो इंटरनेशनल और नेशनल स्पीकर है और बहुत नामांकित व्यक्तित्व हमारे साथ आज उनका ज्ञान शेयर करने वाले हैं। तो हमारा जो आज का सब्जेक्ट है पोस्चरल हेल्थ, द फिजियोथेरेपी योगा अप्रोच, और रिसोर्स पर्सन स्पीकर का नाम है डॉक्टर नीलिमा पटेल, जो हॉनररी डायरेक्टर है पारुल यूनिवर्सिटी में। उनके आगे का जो सब्जेक्टिव विवरण है डॉक्टर मेहुल कॉन्ट्रैक्टर देंगे और बहन का परिचय हमारे डॉक्टर नियतिबेन पटेल देंगे। तो मैं दोनों को इनवाइट करता हूँ। प्लीज डॉक्टर मेहुल कॉन्ट्रैक्टर गिव शब्द समूह टू आवर host, guest, and all attendees.
Thank you, sir. Good morning, one and all the participants and those who are watching us on Facebook Live. Yes, again we are back with a wonderful session with our respected and dignified resource person, Dr. Nilima Patel. Guys, તમને બધાને કહું ને તો આ એક એવી પર્સનાલિટી છે કે મતલબ કોણ નહીં જાણતું એમને, રાઈટ? ઓલ ઓવર ગુજરાત નહીં પણ ગુજરાતની બહારની બી વાત કરીએ તો કોઈ પણ કોન્ફરન્સ છે, નેશનલ કોન્ફરન્સ, ઇન્ટરનેશનલ કોન્ફરન્સ, એઝ અ સ્પીકર તરીકે એન્ડ એઝ અ ડિગ્નિટી તરીકે એક એવું હોય ને કે આમ એ વ્યક્તિની પ્રેઝન્સ ત્યાં આગળ આવી જાય ને એ જે ઓરા ક્રિએટ થાય, that is something different and I really mean it. Okay, because in our field there are very few people who is most senior and respectable. તો એમાંથી ગુજરાતમાંથી ઘણા ખરા એવા આપણા છે, એમાંથી આપણે નીલિમાને છે આપણા. So she is the one, and today we all are blessed that we are going to listen her live on webinar. Okay, and all the viewers and the participants, I would like to request you, all of you, that in the lockdown, we must have rested so much, or we have worked in a different way, because working at office and working at home is completely different. So there might be the one should have a postural awareness. Okay, so when the other day I was talking with Nilima ma'am, the ma'am asked me કે મેહુલ આપણે શું કરવું જોઈએ, કયો ટોપિક કરવો છે, તું કે એવું આપણે કંઈક કરીએ. And then I was just coming with the idea કે મેમ આપણે લોકડાઉનમાં છે ઘણા દિવસથી, તો ઘરેથી કામ કરીએ છીએ ને બહારથી કામ આપણે ઓફિસમાં કામ કરતા, both the things are different. Okay, ઘરે થોડા કેઝ્યુઅલ હોઈએ, આપણા ફોન પેસ પર હોઈએ, અને બહાર થોડું આપણે લોકો people are watching us. So એ બેમાં છે ને પોસ્ચરલમાં થોડું ઘણું ડિફરન્સ આવે એવું લાગે છે મને. તો જરા એના ઉપર આપણે વાત કરીએ તો કેવું રહેશે? And she was like, very good. And we are bang on target with the same day, same time. We are live with all of you. So my request to all of you is that please listen to her very carefully, because she is going to enlighten a lot of important things that we encounter in our life. Okay, because we see many of the patients, okay, with the postural default. But the first thing first, basics આપણે કહીએ છીએ ને કે પહેલા પોતાનું posture કેવું છે જરા જોઈ લઈએ આજે આપણે, right? So thank you very much, ma'am, for accepting my invitation, and I'm overwhelming all the feelings. I cannot express it right now, but I'm very happy, ma'am, very happy to see you. Now Niyati ma'am, please warmly welcome our respected dignitary speaker.
Okay. Good morning to all. Myself, Dr. Nilima Patel. I'm an assistant professor at Shree Odhavram Physiotherapy College. I heartily welcome to Dr. Nilima ma'am as well as all viewers behalf of VN Patel Medical Campus as well as Shree Odhavram Physiotherapy College. And I am going to introduce. She's a very enthusiastic and very no any words for the ma'am, because I am always seeing ma'am as an active mode. ક્યારે એમને એવી રીતે નથી જોયા કે ના મેડમ આમ થોડાક રિલેક્સ થઈ ગયા. She is on always active mode. So ma'am,
one second ma'am, not active mode, proactive.
Okay.
More than active. We should learn. Most senior faculty is still delivering a lecture, that means new coming people in the academic life, and they should have an idea that still in today's era also, with the same impact, with the same power pack session, if she is working, we are somewhere nearby her right now. Okay, like
Definitely.
we cannot even imagine also. Okay, so
Yes,
we should have an idea that how far we need to work right now. Okay,
definitely.
so she is a proactive.
Yes, sir. Sir, ma'am is a fellow of Indian Association of Physiotherapy as well as ex-principal and HOD of the Government College of Physiotherapy at Baroda, as well as ma'am was a faculty of medicine at the same as Government College of Physiotherapy at Baroda. Now, recently, ma'am working as an honorary director of physiotherapy at Parul University. Ma'am is the author of Yoga as well as Rehabilitation book, which is special appreciated by the Narendra Modi sir in 2008. Ma'am got so many awards like Rashtriya Gaurav Award, Physio Ratna Award, which is 2 times, Experience Excellence Award, Pride of the Gujarat Award, as well as Significant Contribution Award, which got 6 times in the field of physiotherapy. Ma'am got the Lifetime Achievement Award, Others Vyaktitva Puraskar. Next, ma'am conducted more than 150 workshops on the physio, yoga, as well as rehabilitation in all over the India on the invitation. So this is the brief introduction of the ma'am. So I would like to ma'am to deliver the lectures. Thank you, ma'am.
Very good morning to one and all participating in this workshop and definitely the organizers of this wonderful webinar. It's always an honor for me, a privilege for me, and a learning experience for me whenever I participate in a workshop or a conference or a seminar, or I'm talking into it, because I still consider myself as a student. Because I think learning is a continuous process and one is student for lifetime. And I think so that should be always the zeal for everyone, because the day you feel I know everything is end of your growth and development. So thank you, Odhavram Institute of Physiotherapy, DN Patel campus, and the organizers so much. Coming to the topic of postural health, just before I start with my presentation, I would like to say something, that as Dr. Mehul said, that it's all how everyone is sitting today, right? So today, if I'm sitting with my hands closed on chest, this is said to be closed posture. Okay, this is said to be a reserved posture. The person is not ready and open to ideas. You'll be surprised to know this, right? But if a person is sitting confident, the hands at the side of the chair or on the lap, this is said to be an open posture where there's a good eye contact, there's good zeal to learn, there is good open-mindedness. So the postures can be explained in so many aspects. It is really a point to be understood by everything. It's just not state of alignment of the body or the center of gravity within the base of the support. Yes, as a physiotherapist, we need to know this. I always mention I'm proud to be a physiotherapist, but I'm privileged to be a psychologist, but I'm blessed to be a yoga student. Because while I was in my college, when I was student, like many of you, I always used to see that any condition in physiotherapy, whether it was a simple fracture case or whether it was a case of women's health or it was a case in a neuro physiotherapy unit or cardiac rehab program or a respiratory rehab unit or spinal injury unit or painful syndrome unit, everywhere posture used to be assessed. First point, posture as an observation, and as an examination also posture used to be the first point. So I always used to wonder that if it is just simple body alignment, then why it is being considered in so many areas where we as physios intervene. And definitely that time also it was always how you sit, how you stand, and your plumb line and your level of shoulder and your ischial tuberosities and your foot placement. That was always we were examining. And I think so at many places. Please forgive me if I'm saying something different, but today also this is the only thing which is being observed and examined. So as I did my course, as I did my master's in clinical and community psychology, I interacted a lot with the psychologist, the psychoanalyst, the counselors, And that time I used to see most of the patients who were into depression, who were having low self-esteem, who had a feeling of dependency, they had more of a slouch. And I used to wonder, yes, if it is just simple body alignment, and we used to go for so many programs, like what we were explained, yes, sit straight and stand straight and breathing programs and everything, the wall squat test, but no sooner we interacted with them, we had one-to-one talk with them, and we gave them a chance to open up, share what is going on within them, automatically the changes were observed. So definitely posture is a state of our inner self. That also is one of the aspects which I understood while I was going for my course in clinical and cognitive psychology. Then I climbed up the stairs of Yog Niketan, which is MS Institute of Research in Yoga and Allied Therapies. And there I really came across what ideally is yoga. And that's how I integrated the science and spirituality together to see how I can do for this posture programs. And I'm eventually going to talk about what is the difference between posture and postural. So if you see, if it is just simple, why don't we use the word, why do we say postural exercises? Why don't we say posture exercise? See, many times we say postural counseling. We don't say posture counseling. We say posture. We don't say posture assessment. We always say postural assessment. Yes, postural feedback, postural ergonomics. So I went on contemplating a lot on these two words, posture and postural, and I came across the difference very well explained in medical dictionary. That is what I'm going to talk about, and that's how I connected the body, the mind, and the spirit, how it takes care of in our postural programs. So, friends, I know every webinar is teaching us something. It's wonderful events going on. This lockdown has connected so many of us in so many ways, definitely. But this is going to be, of course, my videos have been uploaded in this lockdown period. I learned so many things about digitalization, and still I'm learning things. When I get a little disturbed, I take help of my nephew, and then I get things sorted out. But here again, I just came across certain aspects, and then I learned how to go for videography and uploaded the videos. And now there are 8 videos on posture, postural health, holistic approach, postural health, good posture, bad posture, and I've conveyed a lot through that. So that is something different. But here I am aware that there are many students also sitting over here. There might be interns, PGs, and some professionals, and some of the non-professionals also, I wonder. So I've simplified the topic to such an extent that my message should be able to reach out to as many as possible. So here I go for my presentation, and I'm sure things will be self-explanatory whenever I'm going through the slides. Okay. Share screen. So here we are in the state of advancement or disadvancement. Okay, we are progressing or whether we are regressing. This picture has been popular so much in this era of science and technology, where we started and where we are going to land up. And if you just see the person who's in the center with a dand, with a stick, with a staff, right? A very significant point which I have come across when I talk of Dandasana, the long sitting yoga posture. How you can, and definitely in many of the physios might be aware, we talk about wand exercises. How can stick help us? So first the stick was definitely taken for a support, then the person became erect, then again the person started slouching, and today where the scenario is really a matter to be thought of. Whether we were right brain dominant people or we are today left brain dominant people is really a big question mark. We talk of research, but what about the search within? And that's why today all of us are blindly following whatever is being talked about at different places, in different newspapers, in different websites, about how to improve immunity and how to eat this food and that food, and so many things are coming up because we are regressing too much into from spirituality and becoming too great a technocrat. It is balance of both the tools which can definitely help us to go ahead. And that's how I came across with this concept of Physiyoga, physiotherapy, a comprehensive approach of physiotherapy and yoga science. Both are science in itself, wonderful sciences. And so when I talk of physio, I always say biomechanical assessment of a person's posture based on the biomechanical principles and the principles of exercise therapy, exercise physiology, and clinical status of that person, whether a person or a patient, and based on all the assessment of the body, mind, and the self-esteem, I work about on yoga guidelines. And it's just not the postures that people are talking about today. They are, and that's how I connected these two sciences, physiotherapy and yoga. So it's more of a psychophysical approach. It is, I always mention everywhere where I talk, body is definitely through which we go for our all day-to-day activities. But who commands the body? Definitely it's the mind. But who guides the mind? It's the spirit within. We all are aware about the big earthquake that happened in Gujarat. We are aware about the World Trade Center. The terrorists, they were too intelligent people. So does intelligence lead us to good health? No, it is the intellect that can lead to good health. Intellectuals, because intellect makes us think what is good and bad. Intellect makes us understand what is right and wrong. Intelligence, if we are ruled by mind, and IQ is the concept of mind. So if I'm too intelligent, but I'm not wise, I can misuse the powers of mind. But if I'm intellectual, I'm a wise person, if I'm guided by my spirit within, I may take always a right decision. And that is what I always talk when I talk about psychophysical approach. So we should be ruled by our wisdom and not just by the mind. Mind can make us do good things, fine. And that is what the terrorists did. If they were intellectuals, they would have thought, how can we cause destruction and loss of lives of so many innocent people? So they were very intelligent. They were intelligent than the Americans, and they could strike exactly where they wanted to strike. So do we really need to be intelligent, or do we really need to be intellectual? And that is what my guidelines are going to be, right? So the self-esteem, if you see on your screen, the lady who is so happy, connected with the nature, she's happy, and that's why she does not need to, the legs are absolutely in the air, the arms are spread wide, but her posture is so erect. She's so happy. So it is the self-esteem and her happiness within that has maintained her posture so well. The face is the reflection of our inner self. The lady who is sitting in the center, she's a pregnant lady. She's meditating. But definitely, the face seems to be somber and at peace. But I can read out that she is in some stress. Definitely, but she's sitting in a posture called as Sukhasana, a comfortable sitting posture. And during antenatal programs, it's very, very important to give our patients the guidelines on that. On the other side, if you see the hunchback, girls are facing so many, the young girls, the teenagers, they are suffering with maximum postural issues today. And when I have conducted workshops at so many places, whether it's Dehradun or whether it is Kochi or whether it's Trivandrum, definitely in Guwahati. But I was so happy while I was in Dehradun, I was surprised that when we went for postural assessment, functional assessment, all the students were good and they participated so well and their functional status was also good. But well, whether in the eastern part of the country, they were relatively better, but the western part, that is our Gujarat and whether it's Mumbai, Pune, and the Kochi, I found slouch. Why so? Because as more westernized we became, so our posture problems increased. Dehradun, I was some of the colleges 15 to 18 years back कि मैम यहाँ तो डिपार्टमेंट खोलना भी एक चैलेंज हो गया है क्योंकि ज्यादातर किसी को पेन ही नहीं होता है तो पोस्चर प्रॉब्लम्स ही नहीं है व्हाई बिकॉज सी कॉन्स्टेंटली उत्तराखंड इफ यू सी द हिली एरिया पीपल आर क्लाइंबिंग अप एंड डाउन द स्लोप्स दे आर ब्रीदिंग नेचुरल एयर the expectations are very less from others. They are hard working. That doesn't mean we are not hard working population, but we got so much carried away by the comfort and Western culture. So even the topographical placement also makes a difference, and age also has a difference. So there cannot be standardized guideline for everyone because I feel very pain with 5 postural exercise for back pain, 5 postural. No, everything has a role to play. Every individual is unique. You see that right side corner, food also has a very important role to play. And nowadays you might all be so thorough about what to eat and what not to eat because since 2 months and continuously we are going through this guidelines. And definitely if you see one of the workshops where I was conducting, 2 females, definitely I asked them to practice. This is called as Utthitasan, one of the best posture to take care of all the weight-bearing joints of the lower limb. And you could see a lady, she went quite low down because she was not much able to control her posture with anti-gravity mechanisms. And the lady who is definitely holding it quite well with the hip externally rotated, foot definitely placed properly, she could control, and you see the posture is erect. So here as physios, we have a very important role to play when we talk about posture with reference to biomechanical analysis. So coming to this topic of postural health. Health, a very important term. Health means to heal, to care, to give comfort, to give security, to heal. And that's how the word health has come up. And coming to posture, posture has traveled a long distance. So it Latin word, it was labeled first as ponier, right? Then people in France used it as postura. And then in England, the word posture came, and our whole physiotherapy syllabus has been framed by the Britishers. WHO framed the syllabus, and it was the Britishers who finally came up with this word posture. So posture definitely has a great significance in our health, and it is not health of others. First, we need to take care of our own health, and that's what I understood when I did my course in yoga science. Self-discipline. Yoga is self-discipline. Then, definitely, as a physiotherapist, I understood about the biomechanical aspect of posture, and as a clinical counselor, I came to know what can sound, deep, regulated breathing do for our posture issues. So all 3 comply each other, and that's how health of a person can be maintained or it can be taken care of. So here I come across posture. As a physiotherapist, we have only understood about the structural position. But when you go into the meaning of word postural, it has a great explanation. It is definitely a state of position. And when it's a state of position, we definitely understand it as the body position. Postural also helps us to understand attitude of a person. So it is the mind. So when the attitude is too arrogant, you see always a forwarded posture and the shoulders quite elevated, hyperextended spine, right? Or a bold posture, it's a military posture when they are said to be Saudhan, and you just see how they usually stand, right? So that time it's the mind, but also conveys the carriage of one's own self, how you carry yourself. It's the spirit within. So if you are carrying yourself with self-esteem, self-confidence, the posture is never going to slacken. But if your self-esteem is low, if you feel depressed, the posture is going to slouch, the shoulders are going to droop, and that's how it's the spirit within, right? Postural muscles, God has given us such a nice postural reflex which takes care of these postural mechanisms, which ultimately controls the posture. So just asking a person, sit straight, look straight, stand straight, giving them this type of chairs, they're giving them postural correction devices are not going to work unless you take care of the mind and you take care of the spirit That is what the whole effort is. So all of you can check yourself. Is this you? Hunched back, definitely low back pushed forward because of the lazy upper body. Buttocks are flattened, the foot flat, and many times we are walking as if we are carrying the burden of our hand. If you just see the eyes glooming, the face looks so depressed, neck, definitely people are using the accessory muscles to maintain the erect posture of neck on shoulder. If the shoulder fixation is not good, if the shoulder stabilizers are not good, definitely one is going to have a forward head posture. The chest is flattened, the breathing capacity suffer, and definitely a sagging abdomen. And many times because of fatigue and tiredness, we always slouch or take weight asymmetrically, right? And that's how all spinal problems happen. So just going on manipulating on the spine and not taking care of all the other aspects is not going to work. Just going for electrotherapy. The exercise that is going to take care of posture. Now, posture, what can happen if you are so fatigued, is slouching, is tired, headaches, migraine is also one of the reason, one of the cause of poor postural alignment. All types of aches and pains. My PhD is on tension myositis syndromes, physiotherapy and yoga in tension myositis syndromes. We don't have time to explain about what are tension myositis syndromes. Wonderful event or science that has explained about all these things. Multiple joint and when you suffer with headaches and pains, definitely your focus becomes poor, your concentration suffers, your mood swings become very common, and that's how immunity goes down. You're prone to all types of diseases, and definitely as age advances, you see the height reduces and you have poor psychomotor skills, and your efficiency and performance suffer. You are criticized, and the vicious cycle go on. But if you see over here, if a person is happy, you see I just wanted to show the expression. And for me, the body is very secondary. It is, see, the girl's expression is so happy. She's smiling. She's full of confidence. And naturally, her posture is going to be proper. Both are keeping the hands in the pocket. But if you see the ear and the shoulder contact of this girl, and if you see the ear and the shoulder line, see the difference. So this all has a great relevance, and that can affect our health. We all are aware about the types of posture as physios, the good posture and the bad posture. Good posture complements normal breathing. All the three diameters are taken care of, whether the piston action, whether it's the bucket handle, or whether it is the pump handle mechanism. All three mechanisms, they work very effectively because of the normal alignment. And normal alignment is the aligned mind. Definitely the respiratory center is going to give proper instructions to the respiratory muscles, and things can go well. Good posture is a result of spiritual, mental, intellectual, and physical health. All five elements are necessary, and self-confidence nurtures good posture. So be confident, be confident, be confident. No, if I was not a confident person for 30, 40 years of my life, and if the counselor only tells me, be confident and posture will be right, no, that's wrong. Why this confidence level was low? I have to find out what has been caused because of low confidence. Musculoskeletal alignment definitely alters. I have to go for some postural correction programs, I have to go for some stretching exercises, I have to go for core stabilization, I have to improve the breathing pattern. But if I just do technical work and I don't reach out to the cause of that poor posture, things may not work out well. And poor posture restricts the rise and fall of the breathing diaphragm. Many times I've seen so many areas just giving inclined position, reclined position, breathing, deep breathing, deep breathing. Now here you don't know what emotional status the person is going through, and just deep breathing, deep breathing. Definitely the breathing is not going to be the way you want to, because when you are tense, the diaphragm gets rigidly holded high, diaphragm, which can allow the lung volume, and definitely it becomes a laborious breathing, right? So esteem, good state of mind, and body alignment, all three has a very significant role. And poor posture invites distorted, restricted, shallow breathing and a host of other problems, including lessened self-respect and depression. Here, everyone today in lockdown period, all of you might be wondering, how were we sitting all the watching this or listening to me in this position? And if you are, please correct yourself. Right? Are you aware about these postures? Sustained postures, repetitive movements, combined movements. These are some of the areas which can definitely cause so many. If you just see the expression of this girl who is on the top, first picture, she's tense and see the slouching. The second one is happy and comparatively relaxed. Her eye contact with that is relatively good. But see the third picture. As if she's obliging by certain things, and she's taking the burden of her whole head on the hands and the asymmetry. What I'm trying to explain is only posture is expression of our inner self, or the way we carry our body and how we work throughout the day. So my faith, God gave you skill, very brave girl. She's an MBA. She was labeled as a bedridden. She would by UK government that she'll always be bedridden in her life. She was given a handicap certificate. Luckily, she was brought to India, and somehow some people made her say, "Can you just meet ma'am and let's see what we can do for her." And things we worked out for 2 years, and you can see she was walking with me in one of the very well-known gardens of Baroda Kamati Garden. And only thing what I would like to say, if you have a spiritual orientation, you develop an inner faith and healing thyself and others. She is a wonderful lady. She's and after things happened, now she's mother of a very cute baby who is 1.5-year-old, and she daughter, and you give me a life. Because I said no, it was not I gave you life. It was your own inner confidence that we could bring you. Definitely, 2 surgeries were done, 2 hip replacements were done, and things were better. So this is what I usually specify. Coming to the word health, Upanishad, WHO has defined health very late. Our Upanishad, I got one of the sutras of Upanishad translated. So when the senses are still, when the mind is at rest, when the intellect wavers not, then the body is in perfect health and fitness. See the mind-body concept explained by Upanishad long back, and Upanishad has talked about the eyes, the nose, the tongue, and definitely the skin. So many times persons with visual problems, they have postural problems. Person who has problem with hearing problems, and one side is they are not able to hear properly, they can also have postural problems. That at the same time, what I mean to say is our 5 senses are very important role to play for postural upliftment. Mind, definitely, intellect, and then the body. WHO, physical, mental, social, and spiritual well-being. So again, if you see the picture on the right lower end, see the happiness that is there in the family. Social well-being, they will not need any posture correction exercises. Happiness, togetherness, the spirit within definitely takes care of the whole body. And when I talk of postural health, these are the 6 areas which needs attention: the physical, mental, intellectual, social, moral, and spiritual. All these 6 dimensions have a great role to play if you really want to maintain your posture upright. Dina Gardner, all of you as physiotherapists have been referring the book Exercise Therapy. We always used to say Dina Gardner as an exercise therapy, the second and third edition, we were blessed to. Now I just see the all the editions too concise and feel a little bad about it. But this has been explained and we understood it in first year itself 40 years back. It's almost 40 years now I was in first year. The tension of the muscles can be affected by conscious thought and effort and can be relieved by application of conscious thought or muscular effort on the part of a person. See, conscious thought, such an important word. So if I'm tense, my muscles are going to be tense and my posture is going to be poor. But if I give the guidelines accordingly, my muscles are going to definitely relax and I'm going to take care of my posture. This was explained long back. The mind-body concept which people are practicing now is definitely too technical. We have, as physios, we have our foundation in this area right from the course that was formed 55 years back. Why do we assess posture? Because poor posture can be one of the most long-term damaging conditions that a body can ever come. Whether a case of a heart problem or a respiratory ailment or a person, lady with stress incontinence problem or a child with cerebral palsy period, things can be prevented. The consequences of bad posture can be prevented and we can definitely invite good health. It can also lead to poor vertebral disc health, muscle fitness and neural health. Very, very important. The whole concept of neurodynamics, if you go through, if time permits sometimes, I worked out on so many yoga postures and neurodynamic solutions. Wonderful results we get by that. It can lead to fatigue syndrome. Why this thought came to me about postural health? Because I would like to help people come out from the mental fatigue, then the physical fatigue. It can precipitate respiratory problems. I was discussing with one of the groups, proning and prone lying and how it improves the oxygen saturation level in COVID patients. And I was so happy when so many of my ex-students came up with, ma'am, you have been talking about prone lying and Makrasan posture to improve ventilatory and respiratory functions since so many years, ma'am. And things, I said, no, it's fine. Still, it will take time for people and our we left dominant people to correlate the right brain with the left brain and both the brain together with the self-esteem. It will take some time, but it is not too late. Time is going to make people understand what can yoga do, right? It can induce low cardiovascular health. If you talk to cardiologists, they always say, well, go for a walk, right? Now, cardiologists, I know 3 or 4 big cardiac hospitals in Baroda. I feel sometimes little pain because they have hired yoga therapists. Physios technically do certain things. That is what some of the cardiologists. But yoga teachers, they are doing very well. I feel so pain. Our foundation of physiotherapy is sociology and psychology. How can we be labeled this way, right? And that's how I always talk about all these areas. Cardiovascular health, physios can do wonders, right? So, through postural issues. Women's health issues can be confronted also. TMJ dysfunction. I myself went through TMJ problem because I was trying to go for videography and it's very easy to preach. It is very difficult to practice, but I feel that practice before you preach. So definitely I was on my laptop after 4-5 months and constantly with the straining eyes and not with proper placement of my laptop. I went on straining and definitely I had some aches and pains, and then my tooth, there was no problem with my tooth. I corrected my alignment. I understood what was wrong and things went well. Because early intervention. So TMJ dysfunctions can go overruled if we have poor postures and you just want correcting the joint, it may not go. It affects complete health and fit. So there are so many things which I can talk on this slide for hours together. And hence, my dear friends, students, teachers, firm foundation is must for the house to stand. And if you just see this picture, see the placement of our whole vertebral body. So I was talking to one of a very senior orthopedician while I was a student, and he explained to me, if you go through the CARRIAGE's first page, Orthopedics by CARRIAGE, you go for advanced orthopedics, they have explained each and every health issue has the foundation in the foot placement. And I feel so proud today that we were trained by such teachers and we were guided by such. If you just see this picture, see the spine, the medial border of the foot, everted foot, how can it lead to these issues, these problems? All these areas definitely needs more attention. We don't have time over here right now. So why physio for posture is? Because posture is expression of our inner self. Challenge are there in everyone's life. How you take up the challenge. One of the fastest way to improve our appearance physically, mentally, spiritually is to improve our posture. And yogasans, they are psychophysical posture, which I may talk about. Anxiety, fear, day-to-day worries, poor stress coping mechanisms, and many other psychosocial factors have led to many posture-related problems. And yoga postures, when assessed properly, each and every yoga posture is standardized. There is no side effect, no contraindication. I may not be suitable for that posture to be practiced, right? So I cannot say this posture is good for back pain or this posture. That person is not suitable for this posture. That is what, as physiotherapists, we should understand. Because movement begins in a posture and ends in a posture. We know posture follows a movement like a shadow. This is what, if the posture is wrong, and people with neurophysiotherapy are aware, what can happen if there is no central stability, what can happen to patients with movement disorders? First, it is the postural stability. Posture and core stability. Everyone, core. But are we aware? Core is the core values. See the word we use, core, the central existence of our spirit. Mind, definitely the thoughts. And the body, when we talk about core stability, definitely I consider first are the foot muscles, the balance between the gastrosoleus and the tibialis anterior. First, the postural sway is controlled by these two muscles, which people are ignoring. Please, footwear badlo, footwear check karo, footwear karo. But why footwear? Why not high heels? Because we are not understanding the difference between the co-contraction and stabilization effect between the gastrosoleus and tibialis anterior. Then definitely is the iliopsoas and gluteus muscle. Then definitely the trapezius and the serratus. And then finally the scalenii and the neck muscle. This is how the body goes to maintain the stable posture. Natural posture and normal posture. Natural posture is a posture that we are born with, right? Nothing can be done. You are born with that posture. That is natural posture. And Bowen observational skill has explained. I will not go into the detail. And normal posture is the acquired posture. How we usually, with our lifestyle, with our self-esteem, with our image, with our habitual carriage and all the other aspects. This is how our posture is all about. See, I wanted everyone to know. In utero, when the child is in mother's womb, see the iliopsoas, IP is iliopsoas. And if you just see, then gradually the person goes, unless there is good extensibility of iliopsoas, erectus spinae, neck erectus spinae control cannot develop the way it has to be. The four curves, the two lordotics and two kyphotics. I'm not going into the detail of it. Then the person started taking weight on the knees, and the balance definitely started happening between the hip extensors, erectus spinae and iliopsoas. Definitely these work as the force couple effect, which we have understood in our biomechanics lectures, and that's how the erect posture happened. So I always go for these guidelines for my posture correction program. I first try to see iliopsoas tightness more than gastrosoleus. I try to see whether it's iliopsoas, how it is functioning. Very, very important muscle to be assessed if a person has grown through a poor posture. Normal posture, all of you have come across. I will not read out all these things because there's so much written about all these areas and in the text and books and the web. This is what I talk about, erect posture of holistic view. There are innumerable concepts of human posture, innumerable interpretations. So for a healer, posture is a gauge of mechanical efficiency. Definitely, we are physiotherapists. We have to see the mechanical alignment, economy of effort, no strain. wonderfully, then definitely posture need can be maintained. But what we neglect are the kinesthetic sense. I just give you a challenge. A 50, 60 years person who comes to you with back pain, make them lie down prone and ask them to go for their foot circumduction clockwise and anti-clockwise. You just see how the movement is suffering. The same person, make them sit and watch their legs, feet, and ask them to rotate. See the visual feedback. They will be able to circumduct the feet. But when they are prone, there is visual block. The kinesthetic awareness, if it is lacking, because of age, because of wrong habitual carriage, because of the footwear, you will come get an idea what is the status of kinesthetic awareness in this patient, right? Muscle balance. Here definitely we talk about all core stabilizers. Neuromuscular coordination, neural energy. Muscles are being supplied by nerves by the central feedback mechanism, and that's how the alignment. So when I say neuromuscular coordination, I talk about neural energy. And neural energy is how the thought process are being processed to get a good muscle foundation. Thought process and mental relaxation. Stress coping mechanism. It is not the stress which can cause poor posture. It is if the stress coping mechanism of a person is poor, that can lead to poor posture. And last but not the least, balance of vital organs of respiration, circulation, digestion, and excretion. A constipated person definitely is going to have. Everyone has seen the movie Piku. हर एक motion के पीछे एक emotion होता है, right? If a person is not able to excrete toxicity, mental or physical, the posture is going to suffer. It is a person who cannot digest rage and anger and insult is definitely going to have rigid posture. If the person is not going to breathe fresh ideas and fresh air, the person is going to have respiratory problems. And definitely, if the person has wrong concept of I, the person is going to be ill and always going to be lined up into all cardiovascular problems. This is what I have understood posture is. My interpretation. Will not get all these things. It is because of all these experiences I'm talking about. Here, as a physios, as a neurophysiotherapist, definitely we are aware that three mechanisms control a posture. The visual feedback, very important, the vestibular feedback, and the somatosensory feedback. We don't have time to go into all these details. I just put up this slide because I just wanted to show the role of gastrosoleus, how it takes care in our postural sway. The 5 to 7 degree of postural sway, or when we say 10 to 12 millimeter of our postural sway that happens, is mainly regulated by our gastrosoleus muscle. And hence, why we should not give high heels, why correct footwear. It is mainly to take care of this postural sway and definitely maintain balance so that you don't furthermore challenge the core stabilizers. This is another thing which I wanted my physios to know on the umbrella concept. I have not put one slide. It is said mind and umbrella are useful only when they are open. Am I right? Umbrella, if you carry a closed umbrella, you feel, where did I carry it in my bag today? But if umbrella is open, you see it's so useful, whether it is you want to protect from sunlight or if you want to protect from rains. But if you, same way, it's the mind. And that is how the whole rib cage expansion and erect spine works. Again, there is, on this one slide, I can talk for us together. But this, if you see the pelvic diaphragm, the symphysis pubis, and the coccyx, you see the pelvic floor, and if you just go through the slide, the diaphragm and the spine, the vertebrae, the lumbosacral area, and definitely if you just see the transverse abdominis, they closely work intricately with our emotional poise and well-being. And that's how the breathing gets channelized. So there are so many EMG studies that have been performed on a person with good breathing and challenge breathing, and then corrective yoga postures and just simple breathing programs. They have found very good results on this. So I always say, when you just come across a patient of postural problem, definitely the foot assessment, pelvic floor strength is a key element. Mool bandh, which yoga has explained, and all yoga postures, they facilitate pelvic floor strength. This is I explained to you. Attitude also has a very important role to play in our emotional poise. If you just see a person with good attitude can have very good volume of breathing, and a person with narrow attitude, narrow thinking can have laborious breathing because the chest wall is not opening the way it has to open. And this is how it can be explained. Again, this slide can be explained for us together. If the mental state is anxious, you just see the diaphragm gets stationary, you put thoracic, and you have shallow breathing, and again you land up into so many issues. If the mental state is too relaxed, khao pio jalsa karo, kya kar diya, mauj karo, huh? So what happens? That also is not good to a certain extent, because here the chest gets stationary. If you just see in the first slide, when you are anxious, the diaphragm gets stationary, but if you are too relaxed, the chest gets stationary. The diaphragm definitely has a good descent, but the relaxation is relatively less, and you develop all types of basal segment problems because the abdominal wall is not able to release effectively. But if you see, when the mental state is clear and attentive, that is always going to enhance good diaphragmatic breathing. Deep breathing, unda shwas lo, unda. It's not going to work. You have to have a very good state of mind. You should be attentive, and hence it is always said, educate the person first, then go for technical programs. Sleep also has a very important role to play in postural health. Sound sleep of 6 to 8 hours. If you really want to sure. Hours together I can talk. Who are more prone to postural pain syndromes? People who are perfectionists, who live with low self-esteem, who have feeling of dependency, negativity, hostility, and Buddhism. All these types, they always live with expectations from others. When the expectations are not fulfilled, they get always angry. Anger is expressed. They live with rage, and rage triggers abnormal autonomic activity, sympathetic overactivity, parasympathetic suppression, low relaxation, and hence the postural muscles, they get tensed and fatigued. So personality also has a very important role to play if we really want to help our patients come out of the pain syndromes. Occupation, so much has been said. I'm not going into the detail of all these things right now. So many deviations we come across, good posture and the bad posture and the deviations. For the students, you have so much on net today. What is a sway back posture? What is lordotic? What is kyphotic? What is forwarded? And when you compare it with the normal. The cross syndromes, very good. In Fonda has come up with a very good concept. And again, if you see over here, the two crosses, the upper cross and the lower cross, we don't have time to go into the detail of all these things. But ultimately, it is the balance of the girdle muscles. The shoulder girdle, the pelvic girdle, and with the two girdle being balanced by the latissimus dorsi. And that is what is the bridge posture, which Yoga has explained as Setu Bandhasana 2000 years back. And we call it as bridging exercise. What does the bridge mean? Setu, right? So what can happen in forward head posture? All of you are aware about. Flat neck posture, this is the military posture. The sternum is rigidly holded. So that's what, and if you go to any military campus, if you have lived in a cantonment area, there are so many military officers who suffer with postural aches and pains because they're always in state of attention. Sway back, too relaxed an abdomen, too relaxed a personality. I'm not worried about it. Jo hoga wo dekha jayega. Definitely, idle mind is devil's workshop, and idle mind leads to so many problems. But if a person is ideal, things can be fine, right? The flat, I've just put up some slides just for a little reviewing for students, and they can go into the detail of all these things in future. And here comes the concept of physiotherapy, and this is one of the best postures, Chatushkonasana, some downward facing crawl. I'm coming up with a series of videos on the experiential aspects of yogasanas. I don't know how much I'll be successful, but before International Yoga Day, I want to upload 8-10 videos on the real meaning of your postures. So if you just see the alignment over here, wonderful posture, but the rest, there is a technique to go into it. And if you just see over here, natural isometric contraction of the pelvic floor, the abdominals and the neck. Stability of the girdle and the pelvis. The foot placement, ideal. But it has to be first eval. You cannot go for anyone, any Tom, Dick and Harry to practice. You have to go for biomechanical assessment and then advise on this. The American Academy of Orthopedic Surgery, the posture committee has explained, I was so happy when I was reading the articles. They have said every posture has to be energy conservation position, and all yoga postures are energy conservation postures. Good posture meaning an energy conservational, economical, cosmetically acceptable, requires balance between ligament and muscle tone, regulated by postural reflex. This is what the posture committee of American Academy of Orthopedic Surgery has explained. And when I come across Sage Patanjali's explanation on what is a yoga posture, Sthir Sukham Asanam, Prayatna Shaithilyam, Prasanna Chit Atmin Samaptibhyam. Asana is a state of being and not doing. So when can you have Sthir Sukham? Sthir is stability. When can you have stability? If you are in state of Sukh, that is, if you are in a state of peace, if you are happy within. Prayatna Shaithilyam, effortless. इधर से खींचो, उधर से खींचो, इधर पाव रखो, उधर पाव रखो. That is not a yoga posture. Everyone is talking about showing acrobatic skills and they are talking it as yoga. It is not a yoga posture. It is just a body position. When can you have effortless position? Prasanna Chit. If your mind is happy, if you are having a state of bliss within, then and then the effort will be less and you will be comfortable and you will be stable. And when can these three be there? Atman Samapti. When you are focused, your mind is focused on infinity. A very good explanation by Sage Patanjali about what is a yoga posture. See, mind-body concept has been explained in this, but nowadays, 5 yoga postures for back pain, 5 yoga postures for neck, 5 immunity-boosting postures. I really am surprised when educated elite community talk about it. Science and spirituality to enrich, empower, and nurture. That's what my whole concept is all about. So integrating these two sciences, and this is what I explained. This is a patient, he was told get admit. He had some problem, neck and back, both disc issues. And he was said, if you don't get admitted tomorrow and get operated, things will go wrong. And we worked out together without any, so this person is absolutely fine. You can see the walking stick. He was told that you'll always need to use a walking stick, but things are lucky. He's lucky enough and he travels a lot daily. Why psychology and sociology is a foundation? And we have, as a physio, please understand these two subjects, very, very important. They are just not like that put up in the syllabus. Psychosocial factors have profound effect on our ability to recover because our mental health is the predictor of our physical health. What was in, what is in, and what will always be in physiotherapy? Definitely exercise, because it is an asset to fitness. But are we really aware about the word meaning of the word exercise? X is out and erg means unlock. To exercise means to unlock. Nowhere it is mentioned hath per hilao or use the body. So what you need to unlock, definitely, as I explained, physical unlocking, physical stiffness, physical exercise. Mental unlocking is through relaxation. Intellectual unlocking is through education. Social unlocking is through communication. Moral unlocking is through following core values in life, and spiritual unlocking is self-esteem. So when I talk of postural health, I mean to say go for more of education programs rather than technical advices, prescriptions, and instructions. Abdominal tone is very important factor for postural health. So definitely good breathing program in a good comfortable position, and there's no posture which can compensate the posture of Sukhasana. Whether, please try to understand, if a person is having knee pain, back pain, neck pain, you may use a support, you may use a pillow, you may use a prop, but make them go for Sukhasana posture. You can discuss with orthopedic surgeons knee bending over here is not going to invite. In fact, it is helping more of medial tibial torsion, normal medial tibial torsion. And that is very important for our knee alignment. Requires us together for explanation. Om chanting, when you enchant Om, I'm not being religious over here. Om has nothing to do with religion. You can enchant mantra of any choice. Any mantra you enchant, you put one hand on your chest, one hand on your navel area. While enchanting that mantra, you just see its exhalation. So it automatically, you are improving your abdominal tone. Then definitely there are some muscles that favor, strengthens the eccentric activity of some muscles, some concentric activity. Pilates, I'm talking as physio, so definitely Pilates also is doing wonders. Walking, no compensation like walking for having good posture, exercises, and best, laughter is the best therapy, best abdominal workout. So yoga is a holistic approach. What yoga is not, it is not a form of exercise, it is not a gymnastic, it is not an alternative. Yoga karo ye chala jayega. No, it's not. It is not an alternative. It is not to be experimented and good, which everyone is doing nowadays. And manipulating 30 cases here and 30 cases there. Sorry to say this, but it's happening. Yoga is a science in itself, and all the other sciences have evolved from yoga science. And many times people feel when you talk of yoga, it is religion. No, yoga is it's a very deep science. So what is yoga? It is a special type of exercise through mind regulation. It is means and measure to achieve positive health. It is to be experienced and felt, and it is an adjunct therapy. And that's how I say yoga is connectivity. Yoga is being happy at every moment. We need to be connected within. In healthcare, it acts like a metaphor. It is an adjunct therapy for all psychosomatic, and it eliminates compassion fatigue and illuminates spiritual dimension in healthcare approaches. Western communities talking about all these things, and we in India and many times physios still think yoga as just a technical program. I'm so surprised. WHO, when they framed up our syllabus, they have put up the subject of psychology and sociology in first year itself. So to me as a physiotherapist, it is not to stand on one's head, but it is to stand on one's feet firmly and face life pressure, because it is self-discipline. And it is yoga is to convert our potential energy into kinetic energy. We are movement scientists. We should know what potential the person has and how to give it a kinetic form. And that is also, I talk more on mobility than movement. When we talk of mobility, we are considering the holistic approach. So my foundation of Physiyoga is Ashtanga Yoga, the 8-step ladder which Sage Patanjali has explained. The first 2 steps talks on discipline. First is social discipline. Second is individual discipline. This is not that lecture on Ashtanga Yoga, so I'm going fast on all this. Third, Yogasana. People now myokinetic chain. You just see, Western community has taken up about analysis of a yoga posture, and here still we are fighting with each other and contradicting each other when it comes to yoga postures. See the foundation, see the person, see the muscle work, see the co-contraction of the muscle, and see the alignment. So yoga posture, as a physiotherapist, asana is just 10%, rest is 90%. So why yoga postures? It's more of a sensory motor feedback. It improves mind and body flexibility, and it strengthens the mind, the muscles, the core muscles, the respiratory muscles, the cardiovascular muscles. Because all yoga postures, they are psychophysical postures, they are postural mechanism facilitators, and they have a very big effect on the gait control also, pain gait control. So what is yoga posture? It is a calisthenic, is it an aerobic, is it a fitness program, it is power, it is a blend of all. Each yoga posture has concept of breath awareness, becomes an aerobic program. Calisthenic, kalos means grace. Each and every yoga posture has to be practiced gracefully, effortless, right? So calisthenic, it is a calisthenic program. Definitely fitness, mind, body, spirit becomes a fitness program. Power, definitely power and posture goes hand in hand. Self-esteem. And if all these 4 are there, your mobility and strength is definitely going to be there. Coming to again as a because physiotherapy and exercise goes hand in hand. Each and every yoga posture takes care of all these exercises as we talk about in physiotherapy. But that's what I always say, it needs to be understood. If you go through my book, there are chapters, yoga and biomechanics, yoga and exercise therapy. It's not because it's my book. I have tried to make an effort. That was in 2006. But my concepts and all this are strengthening day by day when I think about this. If you just see the two joint tendon action of a muscle in each and every posture, if you see the force couple effect, if you see the length tension relationship, if you see the concurrent and countercurrent, everything, and if you just see the neurodynamic solution, each and every yoga posture is a what you can say, a package of everything. And so I use certain, it requires assessment. You cannot give a standard program for everyone. So there are some standing postures. I'm so thankful. Swaminarayan College, every year they conduct one workshop on yoga since almost 8 years. And we have wonderful 2 days workshop, and we enjoy a lot. I've learned a lot through all these workshops. There are relaxation yoga postures, how they work out. There are lying yoga postures and with biomechanical significance, how it is to be practiced and how it needs to be practiced. We explain and we discuss, and students enjoy a lot. There are sitting yoga postures. Many of the yoga postures which are used for postural alignment and postural correction and postural health as a foundation. This is what I was explaining to you about the two things. Just see the pelvic diaphragm and the respiratory diaphragm. So when we say cat, camel, crawl, camel, crawl, people are talking about cat, camel, cow, camel. But are you understanding what it is? Yoga has explained about the 3 bunds. Jalandhar is the isometric neck, Udyan is the abdominal, isometric abdomen, and Mool Bandh is the pelvic floor. Each and every yoga posture takes care of all this, and how it regulates the breath. Wonderful explanation can be given. See, these are the postures, women's health, if we are talking about it. As I said, pelvic floor strength is the key element if you really want a good yoga posture. And all these yoga postures, they strengthen the pelvic floor, they help the diaphragmatic contraction and relaxation, and takes care of ribcage expansion and recoil, and wonderful results you can get. This is what I wanted to explain. Vajrasan and Sukhasana. Yes, Vajrasan, if a person sits with the feet out, may lead to excessive lateral tibial torsion. If a person sits with the feet in, that can lead to excessive. But when you are sitting in any of these yoga postures, whether it is Padmasana or whether it is Sukhasana, it favors natural, normal medial tibial torsion. And in fact, it works wonderfully in knee pain syndromes, low back pain syndromes, foot and ankle syndromes, but you need to have first proper biomechanical assessment. These are some yoga postures that are important for a posture. Just see again the person on the right side, Utthitasana. Again, hip is abducted and externally rotated, and then the knee is flexed. So here you are unlocking the knee, you are favoring the patellar glide, you are favoring the foot placement properly. If you see the lower picture, the person standing, again this is called as Utthita. First is Utthit and the second is Utkat, the chair sit posture. How it takes care of co-contraction and how it can biomechanically align. The left side is hamstring stretching, the Uttanasana and Padastasana. Wonderful examples of going for functional stretches and strengthening programs. And this is the classic Malasana, Indian toilet sitting posture. So in Dehradun, when I assessed, when students were made to practice, almost 80% perform very well on Malasana. But when I went for my workshops in Pune and Mumbai, almost all of them toppled, because still in some of the places, Indian toilets are being used. So if we use Indian toilets, the core, foot placement, kinesthetic awareness, co-contraction between gastrosoleus and tibialis anterior, hamstring and quads, glutes and iliopsoas is facilitated. But you can go with guided program of Malasana. Very good posture, and we discuss a lot in workshops. Fourth step of Ashtanga Yoga ladder is pranayam and breathing. So pranayam, is it simple breathing exercise? No. Yogic breathing is very different than simple breathing exercise. Yogic breathing is breathing neural energy, flowing neural energy within the body. So when I talk of pranayam, I explain about awareness. So breathe in faith, breathe out fear, breathe in relaxation, breathe out tension, breathe in present, breathe out past. This is what I made the people in my participants practice, and we get wonderful results, and many evidence-based studies are also available on net. You can go through it. Yoga is a science of search within, right? Still people need to do lots of work on it. Fifth step of Ashtanga Yoga ladder is Pratyahar, which we talk of lifestyle modification, ergonomic guidelines, and that is what is the foundation. Prevention is better than cure. Cognitive ergonomics. Educate a person rather than change the chair and change the sitting table and the footwear. No, educate. Definitely educate and guide. Food also has a role to play. Clothing also has a role to play in posture correction programs. Footwear, definitely the correct footwear, high heels, low heels. Again, it is very subjective. A person has tight hamstrings and you say, I will flat chappal pehno. They're inviting sway back. See, it needs proper, even footwear needs to be assessed and thought about before giving the guidelines. All of you are aware, I'm not going to the detail of all these things. The sixth step of Ashtanga Yoga ladder is dharana, that is concentration. As I said, early to bed, early to rise, postural health. We need to follow the biological clock. There are so many people working late and waking up late. We need to tune up with the biological clock. Proverb, early to bed, early to rise, definitely makes a person healthy, wealthy, and wise. Advice. People who are rigid, closed postures, who are introvert, narrow-minded, they have tensed muscles. Be frank, free, fresh, and flexible in communication always. That is sign of relaxation and compassion. The moral to be followed, I am okay, you are okay, and everything is okay. All is well. 3 idiots have explained to us all these things. And guidance, yes, regularity in practice. Meditation is the 7th step, and Om chanting with ocean waves. Then definitely Pilates. I'm coming to the physio. I talked about the 8-step ladder of Ashtanga Yoga. Pilates as a physio has very good relevance. But here I would like to add laughter is the best abdominal exercise, best medicine, best therapy, best abdominal toning exercise, best stress reliever, best stress booster. Exercise with element of fun. Russian concept. Walking, nothing can compensate for walking. So friends, I know it's almost an hour. All of you might be a little saturated, tired. Exercise spirituality. Spirituality is the art of using our inner sources of peace, love, compassion for healing of ourselves first, then the others. And yoga is a living science, a way of life. So when you develop a yoga nature, you get so many things, even if you're standing on one leg. Okay, definitely Dhruvasana, people are aware about how did Dhruv meditate, right? And still he was standing for so many hours together. It was one leg. We can learn a lot from these mythological stories. So if we have good posture, you have good power, you can become a good leader, you can become a good entrepreneur, you can say bye-bye to pain syndromes, you feel good, you look good, you can maintain ideal weight, you can have naturally a strong core, you breathe properly, breathe normal, your memory functions and cognitive abilities improve. Definitely, you can reduce your stress and you become more productive and more successful in life. You can become fit and you can be attractive too. And hence, as a physiotherapist, what is the significance? You can use all these things for your neuromuscular problems, your cardiovascular, your respiratory, your musculoskeletal, women's health, pediatric disorders, pediatric. We have worked a lot on all this, and the workshops can explain. So thank you for this presentation. But there are some guidelines, knowledge, know what good posture is. Very, very important. Be aware of your breath. Visual feedback, always a mirror. In physiotherapy departments, always mirrors are used. Do some stretches, do some exercises. I have not used the word physical. Do some exercise means do unlocking of all 6. practice yoga, and then use accessories. And these are some things that we use for our workshops, and that is what I would like to end my verbal presentation, and can come back to you for. So over to you, Dr. Mehul.
Yes, ma'am. Thank you so much, ma'am, for explaining so many things regarding posture and how the posture is important in our daily routine life, especially in lockdown, and yoga, that you have, switch over from the exercise to yoga. That was, trick that the one should have in their daily life if they want to become a fit. The starting, the moment you started saying that the way I am sitting, that made many of the participants to sit erect. Okay, ma'am is sitting in this way, let me sit in this way also. So the beginning itself here, you were in the
Can I
character
interrupt?
of.
Can I interrupt in
Yes,
between? Just let
yes,
us
yes,
have a 2-minute session. Ask all your participants to stand up.
yes.
They can listen to me. They may not observe, right? But
Okay.
tell everyone, you can instruct everyone to just leave that chair, leave that screen, stand up,
Yes, yes.
right?
Actually, when they are listening to you, so
I
you
know, I
give the
know.
command, they will
Yeah,
do.
yeah. Okay, so let us go for some
Yeah,
small exercise. Unlocking, real unlocking today. All of you
yes,
stand, right?
yes.
All of you stand the way you can in your own place, but definitely the feet evenly placed, the hands by your side. Now I will instruct you to go for some movements. So 5 times, all of you raise your hands up and down. I'll say 1, you will raise your hand up, arms up, and 2, you will raise your arms down. Okay, so 5 repetitions. So okay, do it. 1, all of you raise your arms up, both together and down. 2, 1, raise your arms up, 2, down. Raise your arms up, 1, 2, down, up, raise your arms up, 2, down. Raise your arms up and down, right? Down. Now you have worked your body up with this. Now please listen to the commands. My second instruction will be, while you raise up your arms, both the arms up, inhale, and while you raise your arms down, exhale. Okay? So I will use the word breathe in. So you will raise your arms up. And I will say breathe out. You will lower your arms down. Okay? We'll go for 5 repetitions. Breathe in. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay, fine. Now I'll go for the third instruction. While I will say breathe in, you will raise your arms up. And while I say breathe out, you will all use the word hush. Followed? So breathe in. And all of you say hush. Right? Breathe in. Hush. Session patyu. Right? Breathe in. Hush. 1 hour is over. Breathe in. Hush. Mehul also will feel 1 webinar over. Breathe in. Hush. All of you sit back in your place. Adjust yourself again in front of your screen. So all of you decide on your own. Mehul, you can tell me.
Yes, ma'am.
First session was good. The second or the third one? Which was
Third one.
enjoyed more?
Third one.
Prakash bhai, which was your audio?
Third one.
Third one.
Yeah, this is the real experience.
Where is Niyati? Where is Niyati? Okay, fine. Niyati also would have experienced this because if
She'll join soon, ma'am.
Okay. So you saw first
And-
one just physical exercise, technical. हाथ ऊपर करो, हाथ नीचे करो. 5 बार करो, 10 बार करो. We give these exercises. Okay, 5 बार, 5 repetitions, 10 repetitions. It's just physical workout. Are you getting the point? It may be boring, it may be tiring, it may be straining also sometimes. The second was with breath awareness, right? So your mind was focused on the breathing rather than those counts. You are only 1, 2, 1, 2. Here it was inhale and exhale. Now here everyone might be having their own pace of inhalation and exhalation. So breathing, breath awareness. So as you incorporate breath awareness with each physical exercises, you are improving the concentration and participation level of a person, which automatically helps in strengthening our parasympathetic nervous system. And that definitely is what is the concept of neural energy through breath awareness. And that is what is relaxation response, right?
Sure.
So in second, you used your mind for performance, but with breath. And third was what? As I said, carriage. All are tired, exhausted, sitting in front of the screen for 1 hour. Manusmriti has said that 45 minutes our normal human brain can tolerate on one topic. After that, it is thoda vagya, upparthi gayo. So for 1 hour, people are sitting and listening. So everyone wants a relief. So you say, hush, right? A true relaxation. So I always tell my patients, go for this word, hush, relaxation in true sense. Hush. The humming sound, the hissing sound. It's very, very important. And if you say, if a person can prolong for almost 60 to 120 seconds, they are said to be relaxed personalities. Not deep inhalation, not deep inhalation. It is prolonging the physiology principle 1:2. Inhalation, exhalation has to be longer than exhalation for postural muscle alertness and awareness. So this is what I mean to say, the physic, mind and body. This is what is Physiyoga. Connect yourself within, right?
Body, mind, and soul. This is three
Body,
parts.
mind, spirit.
Yeah,
soul,
spirit, soul.
right? Soul.
Yeah. Very, very good, very, very informative. And मैडम मैं क्या बोलता हूँ, जो हमारा पाश्चात्य मीन्स हमारा जो पुरातन जो योग प्रणाली है और आज का जो मेडिकल साइंस है, उसके साथ जो आपने बॉन्डिंग करके जो ये पूरी चीज समझाई है, वेरी माइंड ब्लोइंग, वेल, एंड दिस इज फॉर गुड फॉर आवर स्टूडेंट्स के जो ऋषि मुनियों ने हमारे उपनिषदों में जो सालों पहले जो बोला है वो मॉडर्न मेडिकल साइंस ने प्रूव किया है, और ये जो बॉन्डिंग है, दिस इज वेरी इंपॉर्टेंट.
मॉडर्न मेडिकल साइंस बोलते हम प्रूव कर रहे हैं, यस, योग इज एन एस्टैब्लिश्ड साइंस. We have not talked about each and every yoga posture. When you come to now, I'll just give you one example. If time permits, do we have time?
Yeah, we have time.
Yes, ma'am. Yes, ma'am.
There's one yoga posture which is said to be Makrasana, a relaxation posture, which people called it as crocodile posture. Have you heard of this word? There are so many people practicing yoga. Prone lying posture, which people are talking about proning for COVID patients. Yeah, for rehab. Prone lying is helping a lot for improving lung volumes. And so our yoga rishis have explained about this yoga posture, Makrasana, 2000 years back. Makar is a crocodile. Makar, right? Now, crocodile ko dekh ke kisi ko relaxed feel hoga kya? Anyone who will see a crocodile, what will be the feeling? Tension. Then why it is the relaxation posture? Very important to be understood. The body position, as a physiotherapist, I will talk about. You are lying down prone. You are keeping both the hands, your forehead on the hands, right? Both the legs are abducted. Your rib cage is wide open. Our center of gravity is lower in prone lying than in supine lying. If you just see the center of gravity placement, it is lower in all your postural muscles are relaxed. So no work of the postural muscles. So automatically the position itself is resting position. So postural muscles have not to work against the force of gravity. That is as a physiotherapist I'm talking. Second thing, you are placing both the hands below the forehead, Agnya Chakra, right? Now when you have opened up, your rib cage is wide open, right? Now when you are in prone lying, no anti-gravity work, the posture itself is naturally corrected and your all the four curves of the spine are naturally maintained. So what happens? The vertical expansion of the rib cage is enhanced. Now good vertical expansion enhances good lateral expansion, and that will help growth enteroposterior. So you get full lung volumes when you are into prone lying, Makrasana posture. So breathing अपने आप improve होता है. Right? So as a physiotherapist, I'm talking about. Now talking as a counselor, yoga teacher, okay, it is breath. So what do we say? Just don't do anything. While you are in this position, just be aware of your breath. As a pet pulao or chhati pulao, nothing. Just be aware. You will see that the wave transformation from chest to the abdomen. So person automatically starts breathing in a relaxed way. And as a yoga teacher, if I say, crocodile is said to be the survivor. Crocodile does not waste its energy in unnecessary movements. So be stable like a crocodile. So it is energy conservation. Second aspect, crocodile uses the energy only as a self-defense. So if you have abundance of energy within you, you're always conserving energy. So when time comes, you have very good defense mechanism and you can fight back any type of stresses that can come in your life. And the third important thing, crocodile is the only species on the earth that has not changed its structure. Even a lizard has changed, even an ant has changed. We know we have come from where, right? Crocodile is the only species which has no structural change. So crocodile is said to be the great survivor. So here, when we are into that posture, we should have that instinct. I am a survivor. Come what may in my life. As many volcanoes, as many earthquakes, as many tsunamis, as many challenges, I will survive. I will fight back. I am a warrior. This is what I talk about as a relaxation posture to this corona people today, right? And that is how it is going to improve your chest volumes and breathing capacities. It's just not lying down prone, which will improve your oxygen saturation, right? So crocodile posture is one of the class, and each and every posture has a name. People only talk about technique, दो पैर 1.5 फीट दूर रखो और हाथ इसको इसके नीचे रखो, हाथ इसको ऊपर नीचे रखो, ऐसे करो, पेट फुलाओ. That is technical aspect. The experiential aspect is the meaning behind each asana. And each asana has so much to convey, right? That is what I wanted to share today. One of the relaxation posture, Makrasana, crocodile posture.
Yes.
Anything? Any more questions?
Wonderfully explained. Yeah, there are questions, ma'am. Participants, now you can drop your queries and question. If you want to, coordinate with ma'am, please drop your queries in the inbox. And ma'am, while during the session, there was one question, ma'am, how to improve spinal mobility with yoga?
Yes. If some of my students who are sitting and listening to it, they know my favorite statement, proximal stability before distal mobility. So even if we want to improve our spinal mobility, first thing what is required is stability. Foundation of biomechanics, stability before mobility. And I have worked out on 5 kriyas, which we call it as Pancham kriyas. I've analyzed biomechanically also, and I have discussed with exercise therapy principles, with breath awareness, and with scientific evidences. So they are called as Pancham kriyas. So you cannot have a standardized program, but these 5 kriyas have no contraindications, they have no side effects, They can be practiced by any patient of any condition. So crook lying position is said to be the relaxed position for the whole spine. We are aware about it, right? Are you aware? Yet crook lying. So you place the position, crook lying position, but stability before mobility. So girdle stability is very, very important before you go for spinal mobility. So your both the hands will be clasped. You will place it behind your head. So you have stabilized your shoulder girdle. With the crook lying position, you have stabilized your pelvic girdle. Now you want to mobilize the thoracic spine, because rotation is mainly the function of thoracic spine. So even our cervical spine and our lumbar spine are dependent on thoracic rotation. Please understand this, because if thoracic mobility is restricted, the ribcage expansion will be a problem and girdle muscles will not be stable. Your cervical spine and your lumbar spine will not be flexible. So going from knee side to side, that is one aspect. You try to go for, and everything is with breath awareness. So low center of gravity, wide base of support, stability of the core muscles with breath awareness. If you go for all the rotational programs based on the biomechanical function of those vertebrae, mobility of the spine can improve. Now, if you talk of cervical spine, right? Cervical spine. Now, you cannot go cervical spine, atlantoaxial rotation, very important. But if you go lower, definitely side flexion and rotation. And if you go to the lower cervical, flexion and extension. So it will all depend. It will be very difficult for me for you to explain. Like, okay, give this or this. But we have worked out on 5 activities which can help to improve your spinal mobility, which can be explained only through demonstration and practice. I always say, please, yoga is not a science for just preaching through verbal. It has to be demonstrated. You have to evaluate, and then you have to find out where the problem is, and then you have to do mobilization. But Pancham Kriyas are non-controversial. During the workshops, I'm sorry, I have not been able to bring the videos of those 5 Kriyas, but we can have one session sometimes. And again, it cannot be given in the same pattern for everyone. See, Mehul, remember this. Now, I have seen while giving rotation, sometimes the feet slide. If the person has weakness of the intrinsic foot muscle, the feet slide. Now, we have seen while giving these rotations, the person whole slides down. If the person has problem with the upper core, the lower core pulls. Are you getting the point?
Yes.
Now, many times, while extending the knees, while turning knees side to side, the knees extend, the feet are stable. So maybe there is problem between the co-contraction between your quadriceps and hamstring. We have to do all these things. So I'm not, and never for a follow-up standard program for everyone, no. But yes, you have to keep in mind proximal stability before distal mobility. For spinal stability, you need to have good core muscles, strength of good core muscles, right? And before that, as I said, the foot intrinsic. Foot intrinsic also has a very big role to play in our spinal stability and mobility programs. Okay?
Very truly said, ma'am. Very informative.
Yes.
And
one thing, people want to know technical guidelines. So cat, cow, crawl is one of the best non-controversial yoga posture. But it has to be done with the meaning. So when I say practice cat, you all can, we don't have time over here, but all of you can go with a carry home message. You practice cat and cow on your own, cat or camel. Either way it is used. So go into that prone kneeling position and just don't, as you raise your head, inhale. No, you do that. But in that posture, you just use the word meow, meow, meow. Automatically, your transverse abdominis is working. Your intra-abdominal pressure is building up fine. And as you go for cow or camel, you just keep your lips closed. And as a cow hums, a camel, right? You do this. That also is your abdominal tone. So while you practice, as I said, mind, body, spirit. Technically, crawl position, inhale and exhale. No. Make them enchant the word meow. And let them go for cow humming. Automatically automatically it is helping them to improve their abdominal tone. That is natural spinal gliding mobility. Right? One can practice this with breath awareness and with the meaning. Simple activity for as a yoga posture for spinal mobility. All the 30 segments of the spine. Yes?
Definitely, ma'am. Yes. There is one more question, ma'am. That what importance of physio yoga play a role in the time of second and third trimester of pregnancy?
Yes. As again I said, third trimester of pregnancy, the person is a primipara, multipara.
Correct.
Are you understanding what I never give straight answers when I'm talking about you. Yoga is 1-to-1. The age of the female. If the female is having other comorbid situations along with third trimester pregnancy, right? The age, at the same time, the lifestyle of the person. I don't use technical yoga. That is what I said, Ashtang yoga. So I start in third trimester, right from self-discipline, the pelvic floor hygiene. I ask them to follow with good reading program from Garbh Sanskar, right? So Yam and Niyam are the first 2 steps of Ashtang Yoga ladder. My foundation with physiotherapy is Ashtang Yoga, not those technical yoga postures, psychophysical postures, which everyone would like to know, which yoga postures would work, right? So disciplined lifestyle is important. Keeping peace of mind is important for good breath awareness programs and being relaxed. Third step definitely is Ashtanga. The third step is Yogasana. But as I said, Sthir Sukhamasana. That is Patanjali. So if they sit in a Sukhasana position, simple cross-leg sitting position is going to be helpful for them. Dandasana is said to be the long sitting posture, which also is very good in third trimester, right? If they are having abdominal or low back pain or abdomen discomfort, they can go for modified Dandasana. You can make them sit with leg abducted and again follow the breath awareness. That also is a good posture for third trimester. They are non-controversial postures, right? Then in Dandasana, if you make them go into Vajrasana, that also is one of the good yoga posture, but that has to be practiced with care. Third trimester, bridging, Setu Bandhasana, also is a very good yoga posture for in third trimester. The cow camel crawl can be practiced in all the 3 stages. So when you are giving in third trimester, again as I use the word, all conditions should be kept in mind. It cannot be given to all females in third trimester, right? Because you are giving like a wave pattern. The child enjoys the swim into the placenta. So it gives child and mother both a relaxed position for spine and the mind both. So there are so many things, but as I said, it's only after proper evaluation. But don't go for it. But cat cow can be given no side effects, but with understanding. No prone lying postures. You cannot give Makrasana as a relaxation posture in third trimester in any way, but you can give Balkasana as a relaxation posture, right? So Balkasana in lying position, not in the sitting position. So there are many, and the fourth step, breath awareness, pranayam. Pranayam can be practiced in all the trimesters, breath awareness. The fifth is ergonomic guidelines, pratyahar. What a patient of third trimester do, how she should sit, how she should walk, how she should work in the kitchen, how she should lift up the things, how she should economize the energy, what footwear she should wear, what are the food guidelines. This is pratyahar, the fifth step of Ashtanga Yoga. Sixth step is dharana. May improve her concentration level in whatever she is doing, make her fearless, make her accept the new challenge that is coming. So communication, you talk to her, you go for good enchanting of Om chanting or any mantra of her choice. Let her have an outlet. Let her come out with her whims. That is dharana and dhyan. And that is how a successful delivery. So third trimester is a very important trimester where it is important. It is again a pelvic organ. The fetus is a pelvic organ. You cannot go for breath holding postures unwisely. But you can go for proper assessment, and there are certain postures which can be worked out mutually. Okay?
Yes, yes, ma'am. I think the participant has got the answer. And one more question, ma'am. Can physio yoga help in paranormal activities? And if it is yes, then what are the mechanics?
Physioyoga and paranormal.
Yes.
Yes. Very good question. Applications of Ashtanga Yoga are at 4 levels: personality development, disease prevention and cure, which everyone is expecting. It is for positive health, and it is also for functional disorders. Now, suppose a paranormal person, you cannot expect the person to follow your commands and your instructions the way you want to. Are you getting the point? But if you relate a lot to the person through your communication skill, your mental energy, it gets tuned with the mental energy of a person whom you are dealing with. Definitely, you work as a counselor also, and as a healer also. And you can get so many things extracted from such persons. And that's why in many of the setups, hospital placements, they have hypnotherapists, right, who work at both the levels, the mind and the body levels. And then you have to use those skills, how to get them out of it. So if there is structural organic brain syndrome, which has led to a paranormal personality, then definitely you cannot have a direct role to play. But you can modify the lifestyle. As I said, Ashtanga Yoga talks about yoga as a way of living, yoga as a way of right living, yoga as a connectivity. Yoga is just not physical workout. Please understand. So with that, you can definitely help them. But yes, if the person is functionally paranormal, you can definitely have a good program based on what type of paranormal behavior the person is having. Yoga has a very good role to play for depression, elimination. Very good. Right? Autism, see, it has a very good role to play. Cognitive behavior therapy and yoga goes hand in hand. Cognitive behavior therapy is what? Is just a form of Ashtanga Yoga, where you focus on breath awareness, postures, education programs, mobility and strength. That is what CBT approaches are all about. And Ashtanga Yoga is the whole Ashtanga Yoga is the foundation for CBT approaches also. So based on the para-abnormal situation and function, you can use your physio program. You can use more of demonstrations. You can use more of expression yogas. You can use more of laughter yoga therapy. You can use more of exercises. I did show one slide. Exercise is what? Exercises with element of fun. If you go to Cash, physiotherapy in neurological condition by Cash has explained very well on exercise. So you use some of the things which appeals to the person whom you are dealing with. And that's how you can connect with your patient.
Yeah.
Hope I was able to answer, because it's a very big topic. As I said, needs thorough evaluation. You cannot, when I'm talking of yoga, it is not a generalized 1-2, 1-2, 1-2. It is connectivity. It is individualized program. Because yoga says each and every one is unique. Each and every one is an individual, right? No genes and no environment can play a role. It is 1-to-1. Sanskar. It's a very deep science. I can see the smile on Prakash Bhai's face. So I can understand what you might all be thinking. What is madam talking in this physiotherapy session?
नहीं मैडम, खरेखर ये पहले से हमारी तो इसमें योग में तो रुचि है हमारी, और हमारी जो धरोहर हमारी संस्कृति है, जो हमें जिसे वर्ल्ड में विश्व गुरु बनाने के लिए जो हमारे पास जो वारसा है, हम भारत के पास जो संस्कृति में, वो दुनिया के कोई संस्कृति में आपको नहीं मिलेगा।
और अगर मैं तो physio for stroke rehab, the workshops have done cerebral palsy. If you talk to Spursh people, Tejas and Mona, we had conducted a workshop, and the students, they know we have worked out on abnormal inhibiting postures, normal facilitation postures for postural mechanism you have to assess. और हमने इतने stroke patients. Now what you use for physio for cerebral palsy child your postures you cannot use for stroke patients. You have to work out, you have to clinically evaluate, and you have to clinically work out. काफी कुछ pain syndromes. I love my programs on pain syndromes. Itne disc lesions. It's not boasting, but I've come across so many of my friends who are orthopedicians, neurophysicians. Ma'am के पास जाओ तुम चलते बनोगे. That is what faith. It is not, as I said, you need to have spiritual orientation to develop faith in your patients, right? That is connectivity. Yoga is just not all these things which are being marketed today. I'm really sorry to use this word. It is a very deep science. बहुत अच्छा science.
मैडम एक रिक्वेस्ट है कि जब ये लॉकडाउन ये सब थोड़ा नॉर्मल हो जाए तो आप एक बार हमारे इंस्टीट्यूट में आके एक वर्कशॉप आयोजित कीजिए इस पे और हमारे स्टूडेंट को आपका लाभ दीजिए. इसमें एक रिक्वेस्ट है मेरी. अभी मैं आपको इनविटेशन भेज रहा हूं.
Always my pleasure. I always reach out to my professionals with respect and dignity. यही एक योग है. आज हम बोलेंगे तो ये वेबिनार लॉकडाउन ने हमारा योग कराया. अगर लॉकडाउन नहीं होता तो हमारा योग नहीं होता. मेहुल कॉन्ट्रैक्टर को मैं फेसबुक पे देखती हूँ, वो मुझे कमेंट करता है, मैं उसको अप्रिशिएट करती हूँ. बट प्रकाश भाई से आप समझ सकते हो मैं क्या कहना चाहती हूँ.
करेक्ट.
दिस इज युगमन opportunity.
Ma'am, lockdown has created an opportunity for all of us.
I have learned a lot.
And
I have learned a lot of digital technology. Learning still I fumble a lot. I never like all this.
With a safe environment. You are learning a lot with a safe environment.
Yes, provided you have a relaxed mind and an uplifted spirit.
And ma'am, अगर
will get tired.
And madam, अगर lockdown अगर खुल जाता है, for the schools and colleges, the first opportunity that what I could see that is 21st June.
21st
International
Yoga Day, and that is what my effort is. I have so many other commitments, and
yes.
I want to upload 10 videos in Hindi and Gujarati in English, just 3 to 5 minutes. Experiential aspect of asana, not the technical. As I explained about makrasana, just like मैं एक हंसने के लिए बोलती हूँ, just for everyone sitting over here, सुनो और सोचो. श्वानासन है. श्वान का मतलब क्या है? डिसेंट मीनिंग हम बोलेंगे इंग्लिश में डॉग. श्वान मतलब क्या है? डॉग. युधिष्ठिर के साथ कौन गया था एंड तक? तो क्या बोला जाता है? डॉग. श्वान गया. कुत्ता गया था ऐसा बोलते हैं क्या? तो कुत्तासन क्यों नहीं है? क्यों श्वानासन वर्ड है? सोचने जैसी बात है. श्वान, श्वास, लॉयल्टी, ऑनेस्टी, रिस्पॉन्सिबिलिटी, एंड कुत्ता is a negative trait of a dog. Are you getting the point?
Yes.
आसन के पीछे इतना भी नहीं, खाली ऐसे उल्टा लटका दिया और इनवर्ड फेसिंग डॉग और अपवर्ड फेसिंग डॉग, ये सब वेस्टर्न कम्युनिटी स्ट्रक्चर को इंटरप्रेट कर रही है. हमारे योग ऋषिस ने तो इसको इतना सारा समझ के ये किया. सोचो, कुत्तासन नहीं है, मरकट आसन है, बंदर आसन नहीं है. मंडूक आसन है, मेढक आसन नहीं है. समझ रहे हो ना मैं क्या कहना चाहती हूँ? ये बहुत समझने की चीज़.
उसके पीछे बहुत बड़ी फिलोसॉफी है.
बहुत बड़ी. और हर एक आसन को मैंने ऐसे इंटरप्रेट किया है कि उसकी स्पिरिचुअल बेनिफिट क्या है, कैसे स्पिरिट को और माइंड को अपलिफ्ट करता है और कैसे हमारी बॉडी हेल्थ अनुभव करती है. दैट इज व्हाट आई हैव एंड दैट इज व्हाट माय फुल एफर्ट इज, बिकॉज एवरीवन इज टॉकिंग अबाउट दिस योग पोस्चर, दैट योग. हर एक योग पोस्चर के आगे एक नाम है. इट्स अ साइकोफिजिकल पोस्चर. आसन इज अ स्टेट ऑफ बीइंग एंड नॉट डूइंग. हम लोग कहते हैं मैं सर्पासन कर रहा हूँ, नहीं बोलते, हमें सर्पासन में हूँ ऐसे बोलते. सर्प क्या एक ही पोजीशन में होता है क्या? एक ही टाइप का सर्प है सर्पासन. ये सर्पा, यू सी सो मेनी टाइप्स ऑफ स्नेक्स. So many types of snakes. Snakes never are in position. Snakes हमेशा हिलता ही रहता है. Flexibility है, उसकी alertness है, उसकी चपलता है, उसका डिफेंस है. लेकिन सर्पासन मतलब हाथ ऐसे रखो, पैर ऐसे रखो, ये करो, सिर ऊपर उठाओ और श्वास पे ऐसे ही सिखाया जाता है. लेकिन सर्प, क्यों इसको सर्पासन कहा गया है? सर्प के पीछे क्या भाव है, भावात्मक आंसू समझना बहुत जरूरी है. तो ये मसल्स को हेल्प करेगा, तो ये रिलैक्सेशन देगा, तो ये कोर मसल्स को स्ट्रेंथन करेगा. ऐसे नहीं होगा है ख्याल में. तो बहुत सोचने की बात है.
Ma'am, there is one more question that the participant would like to know. Is there any absolute contraindication for physio yoga? Because yoga and exercise, they are quite...
That is what I told in my first 2, 3, 4 slides. Yoga is a science of feeling and experiencing. It is not experimenting and proving. Yoga is a science of faith. And if I'm talking as a physiotherapist, the foundation of physiotherapy, if you see, first observe a person. A good physiotherapist has a good observational skill. A good physiotherapist has first to be a good psychologist. टेक्निकली आप करोगे कोई भी चीज, एक जो डॉक्टर होता है ना, वो भी पहले पल्स देखता है, ब्रीदिंग देखता है, ब्लड प्रेशर देखता है, उसके बाद मेडिसिन प्रिस्क्राइब करता है. ये क्वेश्चन मुझे थोड़ा ऐसा लगता है, ये सब इतना टेक्निकलिटी अभी फैल गई है ना योग के बारे में और फिजियोथेरेपी के लोगों में. ये टेक्निक, वो टेक्निक, वो टेक्निक, हैंड्स ऑन भूल गए हैं सर और टेक्निक पे आ गए हैं. योग और फिजियोथेरेपी दोनों मनोदैहिक प्रोग्राम्स है, मनोदैहिक सेशंस होते हैं, माइंड बॉडी प्रोग्राम्स है. तो कॉन्ट्राइंडिकेशन तभी होगे जब आप उसको असेस प्रॉपरली नहीं करोगे और ब्लाइंडली दोगे. आपको पता है कि डायथर्मी ऐसे ऐसे लोगों को नहीं देना है, फिर भी आप दे देते हो, तो वो कॉन्ट्राइंडिकेशन हो गया. तो ऐसे इसमें भी मैं हर शुरू से बोल रही हूँ, प्रॉपर असेसमेंट एंड इवैल्यूएशन. इज असेसमेंट, एग्जामिनेशन एंड इवैल्यूएशन. Assessment is just your observational skill. Examination is you are going one-to-one, and evaluation is your follow-up. तो वो फायदा करेगा. So आप फिजियो प्रिवेंशन के लिए यूज करना चाहते हैं, पॉजिटिव हेल्थ के लिए, या थेरापेटिक यूज. थेरापेटिक योग के लिए काफी कुछ प्रिकॉशंस हैं, बट इफ इट इज जस्ट फॉर पॉजिटिव हेल्थ, फॉर हेल्थ प्रमोशन, there are no contraindications for physio. Are you getting? So physio preventive भी है, promotive भी है और corrective भी है. So physio for a therapeutic program only needs assessment and evaluation. वहाँ हमें contraindications को ध्यान में रखना है. But if it's for positive health and promotion, it has no contraindication.
Okay, ma'am. Ma'am, there is one more question from the participant. Like, can we consider Surya Namaskar as a yoga?
Very nice question. In fact, there's so much of controversy and debate going on, conflict going on within my yoga teachers only on this Surya Namaskar. I have been invited by BHU, where I have presented a paper on Surya Namaskar cycle for sports fitness. I have been invited by our Manipal University Surya Namaskar cycle for health promotion and fitness. I have been invited by one of the national conferences of physiotherapy, Surya Namaskar cycle, preventive, promotive and corrective. I am not against Surya Namaskar, but I am not for quantitative numbers of Surya Namaskar. जो अभी मार्केट में चल रहा है 1008 और 1006 और 108. Surya solar energy, it has a great relevance. पहले सूर्य नमस्कार, सूर्य को पानी देना, सूर्य अर्थ जो बोलते थे, नमस्कार में कहा कभी नहीं बोला कि इधर मुड़ो और इधर झुको और इधर टेढ़े और इधर. नमस्कार नमस्कार है, नमस्कार भाव. Are you understanding the point? But all those 12 postures how they work on individual glandular systems, our 12 breathing programs, our 12 body postures, and how it can have benefit needs to be again evaluated. If I'm a hyperactive person, if I'm an arrogant person, right? If I'll be practicing too many Surya Namaskars without understanding my adrenal gland activity, meri Surya Granthi ko, I may be having a deviated behavior. I may be my behavior may be unexpected by society. I may become egoistic. See, Surya and Chandra Nadi, both Granthis, it has to be balanced. But आपने सुना है कोई भी स्पिरिचुअल गुरु को देखते हुए कि मैं 108 सूर्य नमस्कार करता हूँ, मैं 1008 सूर्य नमस्कार करता हूँ? हमने अपनी पेरेंट्स को देखा है, हमने दादा दादी को देखा है, they are so poised and balanced and work throughout the life. They have never gone to any fitness center, they have never gone to any yoga center and practiced Surya Namaskar 108 or 1008. Then also they have lived such nice, good, healthy life. So I don't want to go into any controversies about Surya Namaskar cycle. Surya Namaskar cycle has 3 benefits. If done with speed and with some understanding and it can work as a very good cardiopulmonary endurance program. Surya Namaskar, when practiced with breath awareness, can work out as a very good program for your mental relaxation and physical health. And Surya Namaskar, when just practiced with meditational purpose, can uplift your self-esteem and spirituality. So there are ways also, there are steps also, there are numbers also, which needs to be done when you practice Surya Namaskar. Right? अभी इंटरनेशनल योग डे आ रहा है और काफी कुछ अभी पेपर में आएगा कि यहाँ इतने सूर्य नमस्कार हुए, इतने नहीं, किसी का एक फेथ होता है तो वो करे, उसके लिए अच्छा ही है. It is matter of faith and practice. It requires अभ्यास. तो जो सूर्य नमस्कार सालों से प्रैक्टिस कर रहा है उसको 1008 करने में कोई प्रॉब्लम नहीं होगा. लेकिन आप एक क्रेज से सूर्य नमस्कार प्रैक्टिस कराओगे और किसी को तो डिस्क प्रॉब्लम, यू हैव टू नो सर्वाइकल डिस्क प्रॉब्लम. मैं बताती हूँ, हमारे फिजियो से बोलते हैं मैडम हमारा फिजियोथेरेपी डिपार्टमेंट अभी बहुत चल रहा है इंटरनेशनल योग डे के बाद, क्योंकि योग इतना सारा योग प्रैक्टिस और योगासन करवा रहे हैं, बहुत सारे पेशेंट डिस्क प्रॉब्लम और ये लेके आ रहे हैं, बैक पेन लेके आ रहे हैं. See, unwise practice can be harmful. Surya Namaskar has a very deep meaning. It is a wonderful sequence, right? But it has to be done with proper understanding of all 3 sciences: physical, mental, and spiritual science. It cannot be practiced or made people to be practiced without any understanding. Okay. So please, Surya Namaskar is a science in itself. An evolution of this, I will share, if time permits, for 2 minutes. First, it was in 15th or 16th century, how these 7 postures came up. Or Raja of Ond, his soldiers were too depressed, they were not ready to fight the Mughals. So the Raj Rishi, जो उनके गुरु थे राजगुरु, उन्होंने बताया कि इनका सूर्य ग्रंथि दबा हुआ है, उनकी एनर्जी लेवल लो गई है, and it needs to be recharged. So they require, Surya is for energy, right? Solar energy, and Chandra is to regulate that energy. So they have worked out on glandular systems. So Surya को कैसे हम उत्तेजित कर सकते हैं, उसके हिसाब से ये 7 postures आए. First 7 postures जो है वो थे. फिर देखा सैनिक जीत के भी आ गए, they won the battle, they came back, but what happened that their interpersonal relationships and their social relationships, because they went always with that jussa, bigger. So, but that cannot work in our social environment. You have to have balance of all the emotions. And then the other 5 yoga postures were added. They worked as cool down. And that's how these 12 postures came into balance of Surya and Chandra. Constantly Surya and Chandra को भी साथ में रखते जाना है और practice करना है. But again, as I said, I don't want to comment on any of these things because it can be misunderstood. It should not be done with craze, name, and fame. It requires yes, faith, and real devotion and bowing down to Lord Sun for the meaning and energy that Lord Sun has bestowed upon us. And I always say, if you really want to know the real meaning of Surya, please, all of you can switch on. Sometimes when you go home, you can type a message letter, Suraj Re Chalte Rehna, one of a beautiful song of movie Raja Harishchandra. Listen to that song, Suraj Re Jalte Rehna. If you will listen to that wordings of that song, what is Lord Sun, you will forget about these body postures, what our life should be. And again, not going to be a political minded person. It is not to talk about any political, but if you see the character and the work of our Honorable Prime Minister Narendra Modi today, right? He talks about Surya Namaskar. The life that he is leading today is just like what that song portrays about your life that should be. Suraj Re Jalte Rehna. You just listen to the wordings. That should be our life process. That is what Lord Sun says. You will forget about this 12 and 18 and 36 and 42 and 108, right? Mm-hmm. Yes, it has a meaning, but experiential aspect is important. But please, all of you, listen to the song Suraj Re Jalte Rehna. I will expect some feedback.
Sure.
Let our character be like Lord Sun, then just that physical builder. Okay?
Sure, ma'am. Ma'am, last question. Okay, because I don't want to disappoint the participant because she has asked since long.
Yes.
The question is,
your time should permit.
Yes. See, ma'am, the session is wonderful, is going, and we have extended because of that only, because the participants are showing their interest. Yes. So yes, ma'am, the question is like, ma'am, if the patient is suffering from diabetes, patient is suffering from hypertension, so at that point of time, which yoga will be more beneficial to that particular patient?
Thank you for the question. I would like to share my experience.
Yes.
This question had come up by one of the pioneers in medicine in Baroda. He is said to be father of medicine in Baroda, Girish Vaishnav sir, right? He's 82-year-old doctor. He was president of Baroda Diabetic Association, and then the association was taken up by one of the other physicians. So that physician called me and requested, ma'am, we would like to have one talk of yours. Diabetic Association of Baroda wants your one talk on physio for diabetes prevention and management, where the physicians and the patients were to participate. Mm-hmm. I was awarded Dr. S. Srinivasan Award for Diabetes Prevention and Management. Okay, it's not to boast. It's not to boast, but I'm talking as a physiotherapist and I'm talking as a yoga student also. So what comment I got after my session was over, Dr. Girish Vaishnav sir said that when Dr. Rumin Shah came up with the idea that we have invited Dr. Nilima Patel for the talk, he said that I felt, what is a physio going to talk about diabetes prevention and management? Why this session? Why this award? And the second thing was yoga. This was 7 years back. So he said, wherever my wife switch on the TV and my family members and sees Baba Ram doing all your posters, so mane utha ke TV khodi karo. That's what, these are his words on the stage. But after I listened to her and the intricacies that she mentioned about the psychosomatic aspect of diabetes prevention and management, the meaning she explained about the word exercise, the depth of the meaning that she explained about adrenal, your pancreas function, I felt that it was a wonderful feeling. So if we are aware about the psychosomatic illnesses and psychosomatic disorders and psychosomatic approaches, we can take care so well in hypertension prevention and management also. which I'm doing right now, where diabetes, and my 12 pages article booklet is being circulated in English and Gujarati by Diabetes Association of Baroda on Physioyoga. It has a great relevance because this is again diabetes, hypertension, they are all now put under psychosomatic illnesses, right? So it is trying to reach to the physical suffering by mental programs, by mental reprogramming, by spiritual upliftment, with ergonomic guidelines, with lifestyle modifications, because yoga is a way of life. Yoga is a way of right living. Yoga is self-discipline. So when you talk about all these 8 steps together, it works very well. But I never say, yog karo diabetes chala jayega, yog karo hypertension. No, yoga is an adjunct therapy. You have to walk along the path of yoga practices, definitely with your medical dosage and all that. Okay, that's how it works for diabetes prevention and management, specifically for type 2 diabetes. Because what triggers blood sugar level? It is not that मीठा खाने से शुगर नहीं बढ़ता है, शुगर एब्जॉर्ब नहीं होता है, इसलिए शुगर ब्लड में, तो क्यों एब्जॉर्ब नहीं होता है? तो भाई पैनक्रियाज आर नॉट फंक्शन, इंसुलिन प्रोड्यूस नहीं, क्यों इंसुलिन प्रोड्यूस नहीं होता है? Right? This is under autonomic control. And autonomic control is again hypothalamus and subconscious mind. So relaxation techniques, relaxation programs, mindful meditation, they work a lot in diabetes prevention and management. Right? I don't say you will cure, but you can help the person reduce the dosage and live a healthy life. Right? Yes.
Yes, ma'am. Wonderfully explained. And ma'am, there are so many participants that they are saying thank you for sharing your knowledge. And I would say, ma'am, this was much needed session, because in lockdown, the people need to be not active, proactive, even though in the lockdown at home also. So this was much needed session. Thank you very much, ma'am.
Summarize, I really like the word proactive. We all have become reactive today, and that's the reason of ill health and so many diseases today. The more we become proactive and we understand our true meaning on this earth, I think so we can be our own healers. And I think so Physioyoga to me is a science of healing rather than treating. Treatment तो बुद्धि की भी होती है, ट्रीटमेंट तो बाल के भी होती है, काफी तो healing तो human being का ही हो सकता है.
Part of healing. Yeah.
Correct. So all the viewers, I'm damn sure that the Power Pack session was so much beneficial to you in your, the personal and professional life, especially during this lockdown period. Okay, so this was specially arranged in terms of, keeping the current situation into the mind. At that situation, how we need to deal with our mind, physical, soul, and spiritual. So that was the agenda to keep the session behind. And yes, all the viewers around the globe who is watching us live, and those participants who is listening to us and with ma'am currently right now, I request all of you to please give us the feedback for the session, so that we can come up with the more and more innovative ideas. And we can also, as the ma'am said, that in today's life also I am a student. And
learning is endless process. Yeah,
there are certain lines that we need to pick in our life to change the life. Okay, so to all the viewers and the participants, please do share your feedbacks, so that we can come back with the more and more power book session. And once again, ma'am, thank you very much for sparing your valuable time and sharing your knowledge with us. Thank you very much.
Thank you very much, madam. Yeah.
Yes, and all of you learn to practice say harsh. Okay?
Yes.
Thank you so much.
Thank you. Thank you being with us. Yeah.